Dear viewers, Assalamu alaikum. Today in our medicinal chemistry lectures, we will discuss what is pharmacokinetics. In our previous lecture videos, we studied what is pharmacodynamics, and then we studied that what are the different drugs and their action on different parts of our body. So today we will discuss pharmacokinetics, which is actually related with the absorption of the drug, then distribution inside our body up to the target, and then metabolism, and then excretion of drug from our body, and the toxic effect of drug on our body. So first of all, what is pharmacokinetics? It determines the fate of a substance administered to a living organism. So we can say that what does body do with the drug? That when the drug is entered inside our body, how our body will react. That is the study of drug movement inside and outside of the body by absorption, distribution, metabolism and excretion, which is called as ADMET profile. Pharmacokinetics. So if we look in detail, so absorption is how will it get in. So the medicine, how it will be absorbed either from buccal cavity, mouth, or intestinal absorption, or intravenous injection. So the absorption means the drug is entered inside our body into the bloodstream. And then distribution is where will it go. So here if we look at here, so it is the distribution. So where will it go? It means that how it will be transported to the target. So it may be bound with the transporter proteins, may be transported freely, and when it binds with the target, it should be a free medicine. Then metabolism. Metabolism means how it is broken down inside the liver, so after performing its function. So when drug performs its function, now it will be broken down or oxidized, which is called metabolism, and mostly it occurs inside the liver. And then the excretion of this drug, so how does the medicine will leave from our body. So what path it will take, either from urination or from stool or from sweating. So different pathways it can take according to the type of medicine. ADMET properties. So what are the ADMET properties? These are absorption. So absorption, mostly we mean that the route of drug administration, that how we will administer this drug inside our body. Then distribution. Distribution is movement of drug inside the body, either bound with plasma proteins or free. Metabolism. Metabolism is breakdown of medicine inside liver after performing its function. Excretion. Excretion means that it will be either excreted from saliva, urine, feces or sweat. Toxicity. Toxicity, when we call it toxicity, we observe that either the medicine is mutagenic or not. So we study the mutagenicity of the drug, and also we analyze the LD50, which means the lethal dose 50. So we will discuss in our next videos that what is LD50 in detail. Routes of drug administration. So first we will discuss that what are the routes through which the drug can be administered depending on its property. So the administration may be local administration or systemic administration. In local administration, we have topical type, in which the medicine is applied through the epidermal or epidermis or skin. Or inhalation. Inhalation, we mean that the drug will take the nasal cavity or nasal part. through which it is inhaled. Systemic administration means the blood will pass through the whole body, and it will be either enteral or parenteral. So we are going to discuss in detail that what are enteral and parenteral. So here, routes of drug administration. So what does it mean that it is enteral? So enteral mean the systemic administration, which mean it is either get from oral, we mean buccal cavity, sublingual and rectal. So these are the paths from which the drug can be administered. So it means that we are going to take from enteral drug administration. Parenteral. Parenteral means the drug is administered through intramuscular injection, subcutaneous injection, intravenous injection, intradermal injection, or local injection. So all these are parenteral paths which is injected. So the medicine is injected either intravenous mean directly into the blood, and the intramuscular or subcutaneous means the inside the epidermal layer, and intramuscular means inside our muscles. So in this way we have different pathways for the administration of drug, and it depends on the lipophilicity and hydrophilicity of the drugs. So most of the drugs which are hydrophilic we take from oral or sublingual, and the drugs which are mostly lipophilic we take through injection. And if we discuss topical, here we are now these two types, topical and inhalation. So these two types is not systemic. So if we look at here, these are local administration. So local administration means to that part of the body. We take like ointment. We for pain we take ointment, or we apply ointment, or any kind of cream on the body surface where we want to treat. So it directly binds with the target. So we are going to apply directly on the target. So it is not going to it is not following the path, the whole path, like it will not get absorbed inside the blood and then to the target. So it is locally applied. So like here we have shown in the diagram that the local administration means that it is directly applied to the target. So it may be epidermic. Instillation. Instillation means the pouring of drug drop by drop, like we are going to pour eye drops. When we administer eye drops, so we will pour one by one. So it means that it is instillation. And irrigation. Irrigation is the removal of fluids, body fluids or water from the body or a tissue. So when we remove pus or mucus from any part of the tissue by irrigation, so it is irrigation. Inhalation. Inhalation is the administration of drug through nasal path. So it may be vaporization of the drug or gas inhalation. So through gas we inhale, or nebulization. So these are the different pathway treatment techniques which are used for inhalation. Absorption. In absorption, the absorption of the drug sometimes may occur from the oral cavity. It depends on the hydrophilicity of the drug. If it is more hydrophilic, it will be absorbed from oral or sublingual. And sometimes the medicine is get absorbed through gastrointestinal absorption. So we also check about medicine. When we design our medicine, we observe that either it has oral absorptivity or it has gastrointestinal absorption. So we check in absorption, we check all the properties that from where it will, our medicine will get absorbed. Skin permeability. If it is not orally absorbed or it has not ability for gastrointestinal. So it means it is not it is non-polar, or it is not hydrophilic. It means that it is lipophilic. So when we have a lipophilic nature of the medicine, so we check the skin permeability. So it will be more permeable through skin, which is lipophilic. So then we administered through transdermal or intravenous injection. So we usually we inject that kind of medicine. Human intestinal absorption, this is another parameter we also observe during drug designing or during absorption parameters. We also observe the either what percentage of this drug will be absorbed from the human intestine. Blood-brain barrier penetration, it is also important parameter that the medicine that we design or we are going to synthesize, either it will cross the blood-brain barrier or not. So there is a barrier between blood and the other parts of the body and the brain. So when blood enters inside our brain, there is a barrier, and most of the compounds will not get not entered inside our brain. So they remains lower side of our body. So similarly, most of the medicines cannot penetrate through this barrier. So we should check that either this medicine will go to the brain or not. So by keeping this in mind, we make such kind of medicines. Distribution. So this is another parameter after absorption. We should analyze that how our medicine will be distributed. So unmetabolized drug enters in blood, tissue, and distributed to the site of action. So when we call distribution, it means that after absorption of the drug inside our body into the bloodstream, the what path it will take to up to the target. So when from absorption to the target, the process or the pathway is called distribution. So when it reaches the target site, then it is distributed. So we call it that it is distributed to the target. So transported, either bound with plasma protein. So here albumin protein plays important role during distribution of our medicine. It will be unbound drug which will be available for transport across the cell membrane. So when it crosses the cell membrane, it should be unbound. So it will be available for transportation across the cell membrane. Similarly, when it is going to bind with the target, it should be unbound. So it depends on distribution, also depends on lipophilicity and hydrophilicity of the drug. So the important parameter which shows us, which represents us that the drug is lipophilic or hydrophilic. So we observe octanol water partition coefficient, that is log POW. Octanol water partition coefficient represents that either it is lipophilic or it is hydrophilic. If the percentage of octanol water partition coefficient is greater, it means it is more lipophilic. Like here octanol, it means that is organic phase. So the more compound will be present in our organic phase than aqueous phase. And if the when we mix our compound, or when we make a solution of our compound, if it is more in aqueous phase, which is lower than octanol, so it will be more, when it is more in aqueous phase, then we call it that the value of this partition coefficient will be less. So it means it is more hydrophilic. So the compound will be more hydrophilic, and it will be distributed through different means. Metabolism. It is the third parameter, metabolism. So after reaching to the target site, when drug perform its function, and after performing its function, either it is going to inhibit some targets or enzymes, or it is going to activate some targets or receptors. So after performing its function, it will be metabolized, because without metabolism, it will not be excreted from our body. So biotransformation or breakdown of drug so that it can be eliminated easily from the body. So this is called metabolism. It is the biotransformation or breakdown of drug so that it can be eliminated easily from our body. It mostly occurs in liver. And the P-glycoprotein are important parameter which determines that either it can be metabolized or not. Because when our drug is PGP substrate, when our drug can bound are going to bind with P-glycoprotein, or it is P-glycoprotein substrate, it means it will be extruded out from the cell easily. So after performing its function, it will be extruded out from the cell. And another parameter which also tells us that what fate will be our drug. So it is cytochrome P450. So cytochrome P450 is essential in metabolism. So it is essential in oxidation of our drugs or medicine. If our compound is inhibitor of this cytochrome P450, then it will causes the adverse effect, and it will inhibit this cytochrome P450 when it will bind that cytochrome P450. So it will not be oxidized and it will not be metabolized. So therefore our compound or our desired medicine or drug should not be cytochrome P450 inhibitor. Now we take that what path it will take through drug metabolism. So what is drug metabolism? The drug will be oxidized. So it is oxidation of our medicine through cytochrome P450 enzymes. So it is phase 1 and we get our metabolite. The second pathway is the conjugation of our drug. Either it is glucuronidation or some other conjugation of the groups with our medicine, so that it can be solubilized in water, or it will become more aqueous or more hydrophilic, so that it can be excreted through the renal elimination or urine. So the polar species, the compounds which are more polar, will be excreted through urine, and the renal elimination pathway will proceed. And if our metabolites is after conjugation or oxidation, it is stable product and it is not going to excrete from the urine, then it means that it is non-polar species. So non-polar species will go through the biliary elimination. So from bile, so bile salts will make it solubilized in bile, and then it will be excreted out through stool. So it will take this path, that is stool. So some medicine also excreted out through sweating or through tears. So in this way the drug metabolism is important. Excretion. So this is our last step. When medicine is after absorption, it will distribute it to the target. It will go to the target, and after performing its function, which we discussed in pharmacodynamics, and our video is available for pharmacodynamics, then it will be metabolized inside liver, and then it will be excreted out. So what path it will take for excretion? Either it is renal path, that is kidney through urination, or bile or rectal through feces. It can take the path from skin, which means that sweating. So through sweating it can be excreted out. If it is excreted from mouth, it will be from saliva, and from eyes it will be in the form of tears. So these paths can be taken by the medicine for excretion. Now we look at the toxicity. So that the medicine that we administered, either it has toxic effect on our body or not. So the first thing we observe about the medicine is acute toxicity. Acute toxicity matters 24.32% for our medicines. So we have to check that either it is acute toxic or not. Carcinogenicity. It is the second factor that we observe that either our medicine is cancer causing or not. That is, it is carcinogenic or not. Third is reproductive toxicity. So we observe that either it will affect our reproductive system or not. Mutagenicity. The drug will cause mutation in our body, like our DNA or RNA, or it is non-mutagenic. So we also observe that. Then hepatotoxicity. Hepatotoxicity mean either it is causing, it is damaging our liver or not. So we observe that either it is hepatotoxic, that it is causing infection inside our liver, or it will damage our liver or not. So in that case, we check that either it is hepatotoxic or not. Aqueous toxicity. Aqueous toxicity also matters, that either it will cause toxicity in our aqueous solution or in our body fluids or not. Skin irritation. Skin irritation, that what will be the effect of that kind of medicine on our skin? Either it will irritate us or not. And then the last factor which also matters is hypertension. So hypertension mean either this medicine will increase our blood pressure or not. So there are some medicines which also increases the blood pressure. So we should also observe, or we should also take in consideration that either we are going to make this medicine, either it will be hypertensive or not. Physicochemical properties of drugs. In physicochemical properties of drug, we should observe that our medicine or drug have what kind of properties. So we observe that its molecular weight. So first of all, we should keep in mind that what is the molecular weight of our medicine. It should not be more than 500 Dalton. So the first factor is molecular weight, because heavy medicine or heavy molecular weight may be toxic or may affect our body. Molar refractivity. Molar refractivity is another factor which should also keep in mind. So we will make a video on these physicochemical properties in detail, that what percentage or what percentage should be in our medicine, that it will be drug-like or not. So we should observe that these what molar refractivity is normal, or what will be the abnormal. Polar surface area. Polar surface area of our medicine also matters, that the surface area, how much surface area is polar or not. So it also gives us in percentage value. So we will also discuss this factor. Charge at pH 7.4. So when our body has pH 7.4, like in our blood, the pH is 7.4. So what will be the charge on that molecule when it is in our blood? Hydrogen bond donors. Hydrogen bond donors, it should not be greater than 5. So we know that there is a Lipinski rule of 5. So Lipinski rule of 5 is important. So we will discuss also the Lipinski rule of 5 and drug-like properties in our next videos. So hydrogen bond donors should not be greater than 5. Hydrogen bond acceptors should not be greater than 5. So if you don't know what are the hydrogen bond donors and acceptors, you may also watch my video on which I have specially made on hydrogen bond donors and acceptors. Rotatable bonds. Rotatable bonds should not be greater than 5. So these also should be considered. Heavy atoms. Heavy atoms mean like oxygen atom, nitrogen, chlorine and fluorine and sulfur. So these kind of atoms should not be more in our compound. So the heavy atoms should also be considered when we make our medicine or design our compound. Lipophilicity. Lipophilicity is another important factor, like hydrophilicity and lipophilicity. So we should also observe this factor. So it can be observed by octanol water partition coefficient also. So we can also observe that factors. So in this way, the physicochemical properties of our medicine or drugs are important, and they should be observed or considered during drug designing. Library screening of drugs based on ADMET profile. We can screen a large number of compounds virtually or in silico through computational means by taking ADMET profile or by considering ADMET profile. So on the basis of ADMET profile, we can screen a large number of compounds, and then we can finalize that what compounds are drug-like, and then we can make their derivatives or analogs to synthesize that kind of compounds which are going to more drug-like, and they observe that ADMET profile. So on the basis of that, we can make our compound. So this how we can screen our compounds through ADMET profile. So we have a video on our YouTube channel, which you can visit that video. The link is present here. On that video, you can observe that how we can screen our compounds by taking these parameters in consideration. So in our next video, we will discuss the in silico prediction. In silico prediction means computer-based prediction of pharmacokinetics, that is ADMET properties and drug likeness of small molecules. So when we are going to design our drug, we should take in consideration these properties, so we can predict before designing, before synthesizing our compound, we can predict the pharmacokinetics or ADMET properties or drug likeness of our compounds. So we will discuss in that video that how we can predict that properties. So thanks for watching my video. If you like my video, please subscribe my channel and share my videos. Thanks.